Hey guys, it's Neeraj. Welcome back to our midterms course here on civil biology. Today we're going to be doing chapter 1, lecture 2, body planes, cavities, positions, regions, and quadrants. So anatomical position, we're going to talk about this first. So it is used when referencing position, location, and direction of the body. Anatomical position is standing upright, head and feet facing forward, and arms at the sides with the palms facing forward. Okay, and then you have your anatomical planes here. So the plane that cuts the body into like top and bottom halves is the transverse plane, and the plane that goes through like the middle of the body, like this, separating it into like front and back ends, is the coronal plane. And so this is actually wrong. This should be the mid-sagittal plane. That's the plane that goes straight through the middle of the body. But then, like, say you take this plane here and you put it here, then it'd be your then that'd be like your sagittal plane. So review time. Jasmine is looking at her pet mannequin. Oh, excuse me. Jasmine is looking at her pet mannequin. Her doll is positioned standing upright, head and feet facing forward, and arms at the side with palms down. Is her doll in correct anatomical position? So take a few seconds to think about that. No, it is not. Correct anatomical position is uh, standing upright, head and feet facing forward, and then arms at sides with palms up. So that's wrong. Which plane divides the body into equal right and left halves? That would be your mid-sagittal plane. Your mid-sagittal plane does that. Which plane divides the body into superior, so upper, and inferior lower halves? Think about that. That'd be your transverse plane. Transverse plane. So body cavities. So here you have your body cavities, and body cavities are essentially the cavities that hold, your vital organs. Like you have your cranial cavity here, that obviously hold your brain. Your vertebral cavity that will hold like your spinal cord, and that can be like grouped as the dorsal body cavity. You see right here. You have your pelvic cavity that would hold like a lot of your reproductive organs. Abdominal cavity that'll hold like the um that hold the organs in like your digestive systems, like liver, gallbladder, kidneys, stomach, large intestine, small intestine. You have your thoracic cavity that hold like your lungs and your heart. You can get an anterior view here. So like, you have your pleural cavities, which hold your lungs, your pericardial cavity, which is your heart, uh, you know, and like all this plus this could be like your ventral body cavity. You have your cranial cavity, your vertebral cavity, abdominal. This can be your abdominal cavity and your pelvic cavity can be your abdominal pelvic cavity. So it's just good to know all this because when you're trying to reference the body, it helps you, find out where stuff are in your body a little easier. Because if someone says something's in your pelvic cavity, you're obviously not going to look up here. It's near the pelvis. So terms for anatomical location and position. So I really like this picture because it gives you a good view of all the anatomical location, position, and direction. So anterior is front, ventral is belly side, posterior is back or rear, dorsal is like the back of the body. So anterior and ventral are the same thing, and then posterior and dorsal are the same thing. You'll often hear dorsal uh, and ventral said a lot more with animals than humans. If you think about like a dolphin, the fin on the back of a dolphin is the dorsal fin. Medial is near the midline, lateral is near the side of the body, proximal is near the point of origin here, and then distal is like away from the point of origin. Superior is closer to the top of the head, and inferior is closer to the soles of the feet. Cephalic or cranial is near the head, and then caudal is near the tail or inferior end. So something that you should really take note of here is this and this. So when you're looking at this image, it says right is here and left is here. And a lot of people may think, why is that? Well, the reason for that is because you always want to think about the patient's right and left. So even though this is, when you're looking at this is your right, this is the patient's left. And since even though this is your left, this is the patient's right. See here you can see a good visual of like lateral and then medial, proximal, closer to the point of origin, distal away from the point of origin. Uh, you have your posterior dorsal here, your anterior ventral here, superior, inferior, cranial, superior, uh, inferior, and then cranial or cephalic, and then caudal here. So Terms of position. So erect is just your normal standing position. Fowler's position, knee chest, uh, lateral, prone, Sims, and supine. So this right here is Fowler's position. This is supine position. This is prone position. This is lateral position, and then this here would be Sims position. So you have a good visual of that. So review time. What word means near the midline or center of the body? Think about that. That would be medial. Medial means near the midline or center of the body. What is the name of the body position used for CT and MRI scan? So here you can see you have your CT or MRI scan. That would be the supine position. You see supine position. This patient here is going into the MRI scan in the supine position. So now we're going to look at abdominal quadrants. So here you have your right upper quadrant, your right lower quadrant, your left upper quadrant, and your left lower quadrant. Again, you know, you might be asking why, but we did go over this. You always want to think of the patient's right and left, so this is the patient's right, and this is your patient's left. Abdominal regions. So you have the right hypochondriac region, the right lumbar region. So that could you can associate that with uh, your lumbar spine, and then your right iliac region that goes with like your pelvis. That's why it's called iliac. Epigastric region is the top middle of your patient. Umbilical region is the dead middle region, and then hypogastric is the bottom middle region. And then you have your left hypochondriac region, your left lumbar region, and your left iliac region. Now, the reason why we have all these different regions is again just for the ease of making it easier to find stuff. Like if someone says there is a hernia in the left lumbar region, you're not going to look on this side or this side or this side. You'll automatically know that it's somewhere around here. So that's why.